Good afternoon, I'm Claire Masterson, and I'm here to talk to you about Caresyntax. The mission of Caresyntax is to make surgery smarter and safer to help patients and caregivers when it matters most. So why focus on surgery? Over 350 million surgeries are performed each year, accounting for 29% of total healthcare spend, which is $2.2 trillion. And yet, the operating room remains one of the most dangerous places on Earth. In fact, it's second riskiest only to the battlefield. 5% of all surgeries result in complications, of which half of those are preventable. So why is this happening? There is a lack of systematic support for surgeons. When I get into my car with its blind side detections and cameras, I have a better support system than most surgeons do. The sort of technology we take for granted in car or aviation safety, or even to assess sports team performance, is really lacking in surgery today. What we need is a digital safety net, and that is what Caresyntax is striving to provide. Over the last few decades, surgery has evolved from originally open heart surgery to minimally invasive and to more recently robotic surgery. But the future of surgery is data-driven and precision-focused. Caresyntax provides value programs that can support providers in their clinical, operational, and financial objectives. Perioperative efficiency, surgeon engagement and retention, clinical effectiveness and revenue insurance programs utilize pre, post, and intraoperative data processed by the Caresyntax platform. We utilize a four-step process. Step one is to identify. We benchmark hundreds of data points from on-time starts to surgical site infections to post-surgical complication rates. Step two, we diagnose. So using Caresyntax's proprietary unstructured video data alongside other sources of data, both inside and outside of the operating room, we're able to diagnose the root cause of any variability. Step three is to implement. The Caresyntax team works with the surgical team to implement best practice into clinical workflow. And step four is to sustain, providing continual data, risk analytics, and AI support tools to embed best practice and continued quality improvements. Caresyntax, in collaboration with its co-development partners, utilizes AI support tools. Tools such as clip assistance tools that can indicate the safest time in a procedure to apply a clip, to motion-based analytics that can differentiate between the most experienced surgeon to a novice surgeon. The scope for AI and machine learning in surgery is absolutely huge. Unfortunately, since the COVID pandemic, hospitals are suffering from an acute staffing shortage, in particular when it comes to perioperative nursing staff. Surgical teams are often reliant on locum or inexperienced nurses, and as a result, case lengths are increasing and operating room capacity is reducing right at the time when waiting lists have never been longer. This is why, in collaboration with Intel, Caresyntax has developed turn-by-turn guidance for nursing staff. Using real-time machine learning algorithms, we're able to provide guidance on procedural steps and surgeon preferences. Caresyntax delivers strong return on investment to all our stakeholders. These include the hospitals or surgery centers, insurers, medtechs, and of course, the patient. Surgeons and surgical teams will always be the primary user of the Caresyntax platform. Using motion-based analytics tools, a surgeon is able to improve their own technical skill as well as train others. We also have CX Connect, which can provide remote support for surgeons during surgery. Insurance companies, both payers and liability insurers, can utilize the Caresyntax platform and the data it provides to better assess risk and process claims. In the near term, insurance will be priced based on the quality of the underlying provider, and claims processing timelines will be reduced from weeks, as they are today, to a matter of hours. Medtechs and tech companies can use the data we provide to unlock the surgical black box. This will enable real-world evidence programs and product differentiation. And finally, patients. They're at the heart of everything we do. In the future, Caresyntax sees a world where care is more available and affordable for all, and patients are able to utilize data to make decisions about their own care settings. Caresyntax is the only vendor-neutral, end-to-end platform in surgery. We don't focus on one module. Instead, we provide a suite of tools that is really able to drive the insights needed to improve quality and safety in surgery. Caresyntax is already in use in over 3 million surgeries a year, and some of our customers include the most innovative hospitals across the world: APHP in Paris, UK Bonn in Germany, as well as UHS and Ascension in the US. We're also very proud of the partnerships we've forged with companies such as Reliance, Intel, CMR Surgical, and B. Braun, to name a few. And we've piloted our technology with the American Board of Surgery to work on video-based assessments for accreditation of surgeons. Caresyntax was founded by Dennis Kogan and Bjorn von Siemens, and they have been working for 10 years now to strive towards their vision of the future of surgery. They've built out an exceptional leadership team who bring a wealth of experience from backgrounds such as Hillrom, Intuitive Surgical, Philips, to name a few. With your support, the team at Caresyntax truly believes the future of surgery is smarter and safer for all. Thank you.